Welcome to the RX Physiotherapy Podcast, your go-to destination for all things physio, rehab, health and wellness. I'm April Patterson.
And Trent.
And each week, we will dive deep into fascinating topics within the health world, from physiotherapy to nutrition and beyond. We cover it all. So sit back, relax, and enjoy the journey as we explore the exciting world of health and wellness. Let's get started.
An ACL tear is one of the few injuries where people are asked to make permanent decisions within days. Swollen knee, uncertain scan, and season pressure. And yet somehow the expectation is that you should already know whether or not you want surgery. And here's the problem with that. There's no evidence that rushing this decision improves outcomes. In fact, the opposite is true. And in this episode, it's about slowing the process down and understanding what surgery and rehab actually do, and just as importantly, what they don't do. G'day, Trent Cooksley here, bringing you yet another episode about ACL injuries, and we're taking a little deeper dive into the surgical versus non-surgical management of this particular injury. So, what ACL surgery actually achieves is an ACL reconstruction replaces the ligament itself with a graft. Biomechanically, that graft restores passive anterior and rotational stability, but here's the key clarification that's often missing. Surgery doesn't restore quad strength, neuromuscular control, movement quality, and confidence under load. Now, multiple long-term outcome studies show that function follows rehab quality, not surgical timing. This was clearly demonstrated in a landmark Cavist review, which showed persistent strength deficits years after reconstruction if the rehab itself was inadequate or poor quality. Now, this kind of highlights that surgery changes the anatomy of the knee, but rehab changes the capacity of the knee. Now, in 2010, Frobel and colleagues published a study in the New England Journal of Medicine which fundamentally shifted ACL management. Touched on this a little bit in the first podcast that I did over ACLs. They compared immediate ACL reconstruction to structured rehab with the optional delay of surgery. And with follow-up reviews at 2 years, outcomes used in the study were identical, and the same at 5 years, outcomes were still identical. And critically, about 50% of the patients that did undertake the study never actually went for surgery at all. This wasn't under-treatment. This was rehab used as a decision-making tool. And the follow-up imaging also showed no increased joint damage in the delayed group either. So this study kind of forced clinicians to ask new questions of, for example, who actually needs surgery and who doesn't. Now, what kind of rehab first approach means, it's not avoiding surgery, it's kind of using rehab to stress test the knee. Work by Eastman, Grindam, and Risberg consistently show that early quadricep recovery predicts long-term knee function, regardless of whether surgery is performed. During rehab, we're asked, does the knee swell after loading? Does it feel unstable? Does strength improve symmetrically? And does confidence return? If the knee is tolerating progressive load, surgery may not add value. If it doesn't, surgery becomes a more informed choice. So who is more likely to need surgery? The literature is clear on patterns. Athletes more likely to require reconstruction include high-level pivoting sport athletes, those with repeated giving away episodes, those unable to regain quad strength, those who persistently kind of have that effusion within the knee despite rehab. Research by Grendam and colleagues demonstrate that athletes returning to elite pivoting sports without sufficient strength face dramatic higher failure rates. Now, this isn't about toughness. It's all about the mechanical demands of the particular sport the athlete is returning to. One of the big misconceptions is that surgery prevents arthritis. Long-term cohort studies by Lomender and Von Port showed that osteoarthritis rates are high regardless of surgical status. Later work by Fulbay and Crosley reinforced that. Surgery does not guarantee better long-term knee health. Systems and function vary widely, and rehab quality remains a major determinant. So questions become which path best prepares the knee for decades of load. This is where the ACL approach that we kind of touched on kind of comes in. So the Melbourne ACL Rehabilitation Guide 2.0 emphasizes early rehab, delayed decision-making, strength benchmarks before surgical consideration. This model exists because outcomes improve when the swelling is controlled, the strength in the knee returns, and athletes regain the trust within the knee. Surgery, when chosen, performs better after preparation. So let's learn this clearly. Surgery is not failure. Rehab is not avoidance. The mistake isn't choosing surgery or not choosing it. The mistake is deciding before rehab gives you the answer. Now, in the next episode, we're going to unpack why ACL injuries happen in the first place and why re-injury risk remains high even after successful rehab. Now, if you have learned something from today, I'm very, very glad. I highly recommend taking a little look into the bits of research that I included in today's podcast. They're very interesting reads. But as always, I'll catch you in the next one.